بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله ورمضان كريم. This is your fourth lecture and it's about skin ulcers. Let us first say the definition of the ulcer. An ulcer is a break in the continuity of an epithelial surface. A break in the continuity of an epithelial surface. Any epithelial surface. Skin is an epithelial surface. If there is something that causes gapping of the skin, that the skin is no longer continuous, this gap is called ulcer. Okay. Ulcer is like any other disease. It has to have a history. You have to take the history of the ulcer. You take the information I gave you in the first lecture and take history about the ulcer. This lecture is about clinical examination. You take the history according to the things I gave you in the first lecture, the guidelines I gave you in the first lecture. And this lecture is about clinical examination of an ulcer. As you see in this slide, you determine the site of the ulcer. The site of the ulcer. Anywhere. يعني ulcer can be anywhere. But in clinical examination, you have to determine the site of the ulcer. On the dorsum of the foot, on the upper third, laterally on the thigh. You have to describe it. In the upper face, on the right side of the cheek, for example, you have to determine the site. Examples of these sites: rodent ulcer is a basal cell carcinoma. Rodent ulcer is a basal cell carcinoma which is found in the upper face. Usually it is a small, long-standing ulcer found in the upper face, and it is malignant. Rodent ulcer is a malignant ulcer. It stays for a long time and it is small in size. It is a basal cell carcinoma. Second example is a pressure ulcer. Pressure ulcer over the pressure points, e.g. on the sacrum, as in bed sores, when the patient is paralyzed for something and he lies on bed. The pressure on the bony areas like the sacrum causes ulcer because of the decreased blood supply, and it causes ulcer. These are called pressure ulcers. Or in the sole of the foot in diabetics. There are so many examples. Trauma is an example. You have trauma, something make wound for you. This wound is an ulcer. If you have an abscess, there is an abscess which opens and brings pus outside. The remaining is an ulcer. There is a discontinuity of the surface of the skin, so it is an ulcer. So these are examples. So many you can go on over your mind, and you can find so many examples of ulcers. Then you have to determine the size of the ulcers in centimeters. I better comment here. Duration and size can help in the diagnosis, e.g. long duration and a small ulcer in the upper face points to rodent ulcer. This is specific for the rodent ulcer. But usually long duration goes with benign ulcers. And the size of the ulcer in trauma according to the traumatic thing. If it's a small thing, it will make small ulcer. If it's a large thing, it will cause large ulcer. So the duration and the size of the ulcer usually, unless coupled by the history and clinical examination, they don't show you things. Unless in this specific example of rodent ulcer, the small ulcer, long standing in the upper face. This is a description of the rodent ulcer, which is a basal cell carcinoma. The second slide, or the third slide, you have the shape of the ulcer. It can take any shape. The ulcer can take any shape. It can be rounded, it can be oval in shape, it can be irregular, according to the cause. Usually rounded or over, according, if it is trauma, according to the thing that causes trauma. If it is an abscess, according to the shape of the abscess, then it will become rounded or irregular. So it depends on the cause. The edge of the ulcer. This is the most important clinical description for the ulcer, because this clinical descriptions tells you about the cause of the ulcer. The edge can point to the possible cause of the ulcer. And when you know the edge of the ulcer, you can say safely that this is benign or malignant ulcer. It's very important to look very carefully and you describe the edge of the ulcer. There are many edges. I will go over them one by one. I will give you examples. Number one, everted edge. This is carcinoma. Everted edge, this is carcinoma, like you see. Everted edge, you see, it goes outwards. So this is everted. The edge of the ulcer goes outwards and this is everted. That's why it's called everted edge. And this is an example of then these are the examples. You can look to this everted edge. This is Marjolin ulcer. Marjolin ulcer is an ulcer found in a long-standing burn. If you look to this picture of this limb, you can see burn around the ulcer. And this is long-standing burn. And this ulcer developed in this long-standing burn. So if you look carefully to the edge of the ulcer, like this here in this area,